In one of our last videos, we talked about what composes a Fontan circulation, essentially what is connected to what. And if I had to summarize briefly, in a typical heart, you have this pumping chamber that sits underneath the lung arteries. This pumps blood actively into the lungs, where it picks up oxygen and it flows back to the heart, which then pumps it to the rest of the body. In a Fontan circulation, there's no pumping chamber between these big veins and the lung arteries. They're connected directly. So the blood has to move passively without any active pumping chamber. Now, how does this even work? If there's no active pump, how is the blood moving passively into the lungs? Think of it kind of like a river. A river flows downstream, and there's no pump in there, but what helps it move is gravity, and it goes from areas of higher elevation to lower elevation. Well, in your body, instead of gravity, it's pressure. The pressure, the more proximally, is typically a lot higher than the pressure more distally at the end of the lung arteries and closer toward your heart. So the blood will flow passively from areas of higher pressure to areas of lower pressure. There's two other things that help tremendously. One is your lungs. Whenever you take a deep breath, your lungs expand, and as they expand, they create negative pressure inside of your rib cage. That actually creates a suction effect that's able to draw more blood into the lungs. The other thing that can help tremendously is your skeletal muscle. These muscles, biceps, hamstrings, all of it, they actually exert a little bit more force onto your veins. And by doing that, they can raise this blood pressure further, which can then augment the blood flow and increase the driving force into the lungs. Now, all this stuff helps tremendously, but you have to kind of understand there is a little bit inherent limitation to the system. If we look at this graph here, on the y-axis is your cardiac output. That's kind of like how much blood your heart is able to pump to the rest of your body. And then the x-axis is exercise. As you go towards the right, you're exercising more. As you exercise more, you have to be able to increase the amount of blood that's going to your organs. Now, in a Fontan circulation, it's a little bit more limited. Because you don't have that active pumping chamber, your ability to augment blood flow is a little bit depressed. And so it's less than it would be otherwise. This doesn't mean, though, that you cannot exercise. And in fact, I've had lots of patients with Fontan circulations run 5K. It's quite the opposite. It's actually more important that you may stay fit because you have a Fontan circulation. Think of it like, since you're missing a little bit of heart muscle, these other muscles in your lungs and in the rest of your body have to chip in to contribute. And those with Fontan circulations that stay active are the ones who do the very best. You don't have to look like this guy. I think nobody should look like this guy. But it's important to stay active in moderation and listen to your body, not pushing yourself past its limits. And also, make sure that you talk to your doctor, because everyone has a different anatomy, and there are, in certain situations, conditions which limit how much exercise you can do or the type of exercise you can do. So make sure you talk to your doctor.